We want to talk to you a little bit today about gastric bypass. And gastric bypass really has been around for 20 plus years, and it really was the procedure that brought weight loss surgery into mainstream medicine. Obesity is related to so many cancers: breast cancer, uterine cancer, colon cancer. I could go down the line, but if we can prevent it by losing weight, I probably put more years of life onto my weight loss surgery patients than I ever have cancer patients that I treated. I think where the real effort needs to be is in cancer prevention. And that's really what drew me into weight loss surgery. When we do a gastric bypass, it's usually a one-day stay in the hospital that night and home the next morning. In fact, that went on to form the basis of the standard of care that CMS, which is the Center for Medicare and Medicaid Services, well, of all the large hospitals have to follow if they're going to contract with the big 7 or 8 insurance carriers. There are countless number of patients who have really changed their life for the positive. You know, some of the general memories that I have are patients who are really in trouble and needed help and couldn't find it anyplace else. For instance, we've treated a few patients who were on a heart transplant list, and then they couldn't get their transplant because their weight. And on both those patients, once we did the gastric bypass, their cardiac function improved so much that they didn't need the transplant anymore. Gastric bypass is still a solid operation. And if that's what your surgeon recommends, or you came to see us and that is what we recommend, I don't think that's something to be frightened about. Even if your insurance company refuses to pay for anything else, and that's what they'll pay for, a gastric bypass, and there's nothing wrong with it. It just takes a little bit more follow-up than, say, a band or a sleeve. If you're interested in it, especially if you have diabetes, it's a really good operation for that. You just got to make sure you get with a surgeon who's experienced with that in a program that can follow you from a comprehensive standpoint.